You are tuning in to Art of Citizenry podcast. I am your host, Manpreet Kaur Kalra. If this is your first time listening to this podcast, I want to welcome you. For those who have listened before, I'm excited to have you here with me again. Art of Citizenry is a community-supported podcast dedicated to decolonizing storytelling. This allows me to have unfiltered and nuanced conversations that challenge how power plays out in conversations around social, economic, climate, and geopolitical justice. We unpack history to really identify ways we can build a more equitable future. To support Art of Citizenry podcast, please give it 5 stars on your favorite listening app and be sure to subscribe. Every 4 minutes, a person is dying in New Delhi. Across the country, India is officially logging well over 350,000 cases daily. Deaths are going grossly underreported. Causes of death are being intentionally mislabeled to create the impression that COVID death rate isn't as bad as it really is. Officially, the daily death toll is around 3,000 to 4,000 deaths per day. In a Time article by Rana Ayub, she cites health professionals stating that the daily death toll is likely over 10,000 people. India's public parks are being used to cremate loved ones as crematoriums exceed capacity, with piles of bodies 10 miles long in some parts of India. Beneath this grim reality lies layers of systemic inequities that prioritize the interests of those who hold the most power over those who are forced to yield it. India's crisis sits at the intersection of neocolonialism, capitalism, and fascism, deeply rooted in a history of extraction and further compounded by various forms of systemic oppression that continue to uphold colonial legacies. Since Prime Minister Modi took office in 2014, India has been in utter disarray. Marginalized populations have been the target of blatant ethnic cleansing. Policy decisions have been driven by corporate interests. Dissent has been silenced and punished, and extreme nationalism continues to threaten the lives of minorities throughout the country. India has a history of human rights violations that far precede Modi's term as Prime Minister. Neglect for human life is a common narrative in a country with such a dense population. To put it into perspective, India has a population of 1.38 billion, despite being 1/3 the size of the United States, which has a population of 331 million. India's reality hits incredibly close to home for me as we navigate honest conversations with our family about mortality, vaccine misinformation, and access to care, with many family members being high risk. It's honestly hard to not utterly be frustrated, and at other times just simply sad to the point that you don't want to talk about it. I have had a handful of family members survive COVID during India's first wave, and this second wave is far worse. I have heard of countless cases of family friends and extended family not being able to gain access to care because beds in hospitals are just not available. Instead, they have to take the risk of seeing how their symptoms pan out at home. Losing loved ones daily is our new reality. Most people have no access to proper care or preventative measures, putting even more loved ones at harm. Despite people actively dying in the thousands every day, the government fails to provide the leadership necessary to tackle this public health crisis. At the beginning of the pandemic, Modi imposed an overnight, nationwide lockdown with only a few hours' notice without consulting any public health experts. This meant millions of migrant workers from Nepal, Bangladesh, and across India were left stranded hundreds of miles from their homes. Without food and shelter, many slept on the streets, risking their lives. Yet again, those most impacted by systems of oppression were hurt by political irresponsibility. During the lockdowns, instead of investing time and money into building capacity for the larger health system, Modi and his government acted as though they had beat COVID and that a future outbreak was impossible. So much so that the country's coronavirus task force stopped meeting, touting around the slogan Atmanirbhar Bharat, a self-sufficient India. Modi even claimed at the World Economic Forum meeting that India had crushed COVID. As documented in a recent article by Arundhati Roy, when COVID was at its peak in the US, Modi stated about India, and I quote, "In a country which is home to 18% of the world's population, that country has saved humanity from a big disaster by containing corona effectively." This falsified sense of safety, further amplified by state-controlled media outlets, led to the pendulum swinging to the opposite end of the spectrum, with the country opening up as if nothing had happened. People continued to go about their daily lives, and Modi painted a narrative that made him appear as though he saved humanity, pridefully boasting about sending 55 million doses of the vaccine to 62 different countries, all while only a small fraction of India's population was vaccinated. Let me be clear. Modi put himself, his economic interests, and his party's political interests above the well-being of India's people. This is a mass murder. In the trenches of India's second wave, Modi continues to prioritize politics over people. As 4 of the country's states went to the polls for legislative elections, Modi threw himself into full campaign mode, attending rallies without any prospect of social distancing and with mostly unmasked supporters. He also gave the green light for a massive religious Hindu festival, Kumbh Mela, which attracts millions of pilgrims to the Ganga River every 12 years. Millions participated in this weeks-long festival, which has turned into a confirmed super spreader event. But Modi did what any politician who cares more about securing votes over public health would do. He gave his majority voter base what they wanted to secure the Hindu vote. As I mentioned in an earlier episode about the autocratization of democracies, Modi's government is thriving on nationalism, the consolidation of power, and suppression of dissent, all of which are built on structural oppression and exploitation. For example, oxygen is currently the most sought-after commodity in India. What is typically sold for 2,000 rupees a tank is selling for 30,000 rupees. To add to this complexity, economically privileged families are hoarding oxygen tanks for the possibility of needing them, creating further scarcity of access for those who need oxygen right now. If anyone publicly solicits access to oxygen, they are harassed by police and are being painted as anti-nationals. In an attempt to control the narrative and create a false reality, The government is clamping down on people soliciting support from community members for their loved ones and threatening healthcare workers to not express anything that might challenge the government's narrative. The government has gone as far as to get the accounts of reporters banned on social media and their posts censored. I wouldn't be surprised if this podcast episode gets pulled down when shared. People are desperate. Survival is the name of the game. The economic disparity we see playing out is baked into how India operates as a country, with India's poor continuing to suffer and the rich getting richer. Wealth disparity is a real issue, and human lives are valued on the basis of the amount of money you are able to cough up. Pride is intrinsically tied to wealth because it is simply the currency used when determining the value of each and every human life in India. I say this as an individual living in the diaspora, fully recognizing the privilege I hold. To put this in perspective, India has the world's largest all-female community health worker program called ASHA, which stands for Accredited Social Health Activist. 1 million strong and often from rural communities, these women are leading the grassroots COVID response throughout India, actively working directly within their own communities, testing and helping facilitate care. Appallingly, as documented in a recent Time article, these women are simply being treated as though they're disposable. Most come from economically disadvantaged backgrounds, don't have access to masks, and are being paid as little as $30 to $40 per month. Now, before you start wondering if that's a livable wage in India, I'm going to provide a little perspective. If a family of 4 in India went to McDonald's and each bought a McSpicy Paneer burger, that one meal would come out to around 1/3, if not more, of these women's monthly salary. To add to this, when these women do get sick, their care isn't being prioritized by the healthcare system. In an article published by Time, one of these women was interviewed and explained that when she asked for a mask at the start of India's second wave, she was told she wouldn't need one because she had received her first dose of vaccine. However, she had to delay getting her second shot because the clinic was 5 miles away from her home and she could not afford the cost of the rickshaw to get there. Everyone at this moment is trying to make a profit. Even rickshaws, which at the end leaves India's poor knocking at death's door. At this moment, I want everyone to realize this reality around health inequity exists not just in India, but in the US as well. If the closest vaccine facility is a drive-through clinic and you don't have access to a private vehicle, you are at a loss. Modi is a leader who prioritizes the interests of corporations over his constituents. To that same effect, the media is controlled by not just the government, but Modi's pals, Ambani and Andani, who are falsely painting themselves as India's heroes despite continuing to benefit off of India's demise, showing us the reality of harm that happens when unchecked modern capitalism and fascism collide. Despite being the world's largest producer of vaccines, India has fully vaccinated less than 2% of its 1.3 billion people. To understand this, we need to come to terms with the ways in which neocolonialism and capitalism continue to influence how we navigate as a global economy. As my guest today so eloquently states, the crisis we see unfolding in India didn't just happen. It's a symptom of an unjust global economy that puts profits before people every step of the way. During this episode, I am joined by Anna Canning of the Fair World Project Together, we peel back the layers of exploitative power structures influencing the global vaccine apartheid.
Fair World Project is really kind of interestingly positioned in this whole world of conversation that we have, that we do what I often shorthand as education and advocacy around fair trade issues. And I think that this conversation about vaccines really touches so much because it looks at the ways that our global system is rigged, and those power dynamics are playing out around the world. And they're also really playing out here at home in the US. And so, we end up doing some work with people internationally, and then also, here within the US, we're members of the Heal Food Alliance and Food Chain Workers Alliance. So we hear a lot also about what's happening with people organizing in communities here that are some of those people who haven't, had the moment yet to hold up their proud vaccine selfie for all these really large systemic reasons.
Whenever talking about issues abroad, it's important to recognize that often these very same issues are playing out here at home as well.
I should start this conversation by the disclaimer that I'm not a healthcare expert by any means. But we do a lot of work within the food and trade system. And I think what we've seen over the past year as the pandemic has unfolded is we've had, this whole term essential worker kind of came to all of our lips last year around this time, or maybe a little earlier. And those are the people who are at the front lines, growing food, processing food, putting food in your shopping cart in the store. And, we've seen that those people have had the highest impacts from the pandemic here in the US. So you've seen like horrible outbreaks in meat packing plants because the corporations couldn't be bothered to slow down the lines and give people access to the protective equipment that they need. And so, that started at the beginning of the pandemic and has really been a theme throughout. And now, as you see, like the next step of vaccine rollout happening, once again, those underlying power dynamics that create those inequities are really being reinforced.
In March, the New York Times published an article about how communities of color continue to be disproportionately impacted by COVID-19, including during the vaccine rollout. I have included a link to the article in the show notes, which is fantastic because it shares the data around how the vaccination rate of Black people in the United States is half of that of white people, and the gap for Hispanic people is even larger. It is just not that these communities need greater access to the vaccines, which they do. It is important to recognize that Black and Latinx communities in the U.S. also have good reason for not trusting the health system. They have been experimented on, treated less than, and suffered from unethical health practices for generations. The global healthcare system has been built with whiteness being the norm. It does not account for cultural nuances that are so incredibly important when talking about health equity and access. At the end of the day, these inequities are rooted in power, with Black and brown communities globally continuing to suffer from the impacts of systemic exploitation. And this issue goes far beyond healthcare, with oppressive systems being further reinforced by the hoarding of wealth through modern capitalism. Just take a moment to think about how our food system is structured and who benefits from it.
There's some really amazing farm worker organizing going on in Florida, for example. Farm Workers Association of Florida, Coalition of Immokalee Workers have been doing a lot of work to get the workers they organize with vaccinated. But that's really been curtailed by the way that vaccine rollout has happened in Florida, that, their governor made the decision to prioritize some of their vaccine rollout happening through the supermarket chain that happened to be a big campaign contributor of his. Surprise. Which is just, it's like layer upon layer of absurdity. But like the real consequences of that is the entire way that our food system is set up here in the US has layers of entrenched racial discrimination layered throughout it. People talk about food deserts, communities where there aren't grocery stores. And, really a more accurate term for that is food apartheid, that it's not that these are naturally occurring places where grocery stores just didn't grow. It's that there were policy decisions made to keep grocery stores out of those communities. And those communities are predominantly Black and brown communities. So when you layer that, on top of the existing disparities for those workers, then you end up in a situation where the people who are growing the food that most of us eat every day are struggling once again to stay healthy.
The reality of our global economies is that it is incredibly racialized. Power structures rooted in slavery, theft, and colonial legacies continue to perpetuate harm by prioritizing those who hold power within our global system, countries of the global north, or quote-unquote wealthy countries. Take a look at vaccine development, for example. There has been a glorification of the global north countries funding the development of vaccines, but at the cost of whom? The COVID-19 vaccine development has been based on trials in places like South Africa, Brazil, and India. But those very communities are the ones currently fighting for vaccine access. In South Africa, where many of these trials have taken place, the first healthcare worker received a shot on February 17th, more than 2 months after Britain and the United States began vaccination efforts.
When you start looking at statistics around where vaccination is happening globally, right? More than 3/4 of the vaccinations that have taken place so far are in 10 countries, the world, and that account for 60% of the world's GDP. And, you see that broken down on a map. And what you see there is, quote unquote, richer countries are the ones that have gotten vaccinated. And then it is poorer countries that haven't. As you look at this, I think it's really important to recognize that the world didn't just magically get divided into rich and poor countries. That, we've talked a lot about the US and the UK contributing a lot of public money to vaccine development. And, then contrast that with right now you see India and the whole COVID situation going on there. I think it's really useful to look at those countries' previous and ongoing colonial relationship in the time where the British Empire had India as one of their colonial countries. They extracted $45 trillion from India. Right. So that is an extraction of wealth that has taken place now over centuries and has really created these wealth disparities. When you're talking about the way that power and wealth are distributed globally, you have to look back to that. It's really important to also acknowledge that the extraction continues, that the way that this is being rolled out is further increasing inequities. There's been some news stories talking about how Pfizer, as they've been, settling up deals with various governments around the world to supply vaccine. One of the other things that we've seen is they've been asking these countries to put up, their federal bank reserves, their embassy buildings, their military bases as some kind of collateral before they will then take orders for these vaccine doses. So this happened in South Africa, and they actually backed down from that. I don't think it's been resolved yet with Argentina or Brazil. But again, what you see is these companies, and there you go, companies and countries are really they have a lot of power, sometimes equal, but that extraction is continuing.
9 out of every 10 people in poor countries will not be vaccinated till 2024. We cannot fully understand the role wealthy countries play in the disparities we are seeing play out in India and now South America without talking about vaccine hoarding.
As soon as it became clear that there was a pandemic, basically, US, Canada, the UK all went out and, went to pharmaceutical companies and placed orders for vast amounts of vaccine. And, some of that was like, okay, not only have we given you a ton of public money to develop this, but now here is a guaranteed market for it. So we're going to pay you again for it.
Each of these countries placed orders for vaccines that would potentially vaccinate 3 times their population, creating supply bottlenecks, ultimately hoarding access to vaccine from poorer countries. What gets me in this whole situation is that now the same countries that created disparities in vaccine access are turning around and sending quote-unquote aid to countries of the Global South, further feeding into this top-down narrative that the Global South needs saving, and the Global North is the savior. In fact, 60 million of the vaccine doses that the U.S. purchased and has now sent to India are made by AstraZeneca. Let's be clear. These are only going to India because this particular vaccine has not been approved for use in the United States, yet again proving that when it comes down to the value of life, we care more about the lives of those in the Global North than Black and Brown communities of the Global South.
One of the things that so many people in the food and farming space say that I think has a lot of wisdom is the system isn't broken, it's working the way that it was built to. You look at fascism around, like really sort of fascist countries around the world, and counting, when US under the Trump administration is one of those. And those are the countries that have had the highest global death tolls and number of cases. So the actual suffering that's happening right now is appalling, especially when you layer it on top of these centuries of destruction and extraction. These are the consequences that this system that has been built over centuries is delivering right now.
As Anna mentioned earlier, both countries and companies hold a lot of power and have the ability to dictate how we respond to moments of crisis as a global community. However, when we begin to peel back the layers, so much of how governments operate is driven by corporate interests, with those who hold the most wealth essentially dictating everything from policy decisions to how we approach public health crises.
You see companies like Pfizer, Moderna, et cetera, and then you see the ways that there's so much corporate capture within our political system, which means that those companies actually have a really disproportionate say in how rules and policies get made in our governments. In the US, in the UK, especially, I don't know the figures for each country around the world, but something like hundreds of billions of dollars have gone into funding this vaccine development, both, in the really short term and then the research behind it over the long term. So that's all of us who pay taxes in the US. That's our money that has gone to that. I would love for that to then be a global public good. But instead, the way that the system works is corporations have figured out how to socialize the risk and then privatize the profits. And, what we've seen in the last year is there's actually just a investigative report that came out last week, I believe it was, showing that Pfizer, AstraZeneca, and Johnson & Johnson together have paid out $26 billion to shareholders in the past year. I mean, that's like an unfathomable amount of money for me. But, one of the dots that people have connected there is that with that kind of money, you could inoculate the entire 1.3 billion person population of African countries. And instead, that's going to all the people who have shares in those companies. I bring that up because one of the big talking points that we hear over and over again is, these companies, they need to be making money off of these medicines, because otherwise, how are they going to develop the next cure for whatever the next disease is? And the reality is, you and I are already paying for that development. And they are continuing to make a lot of money off of it and pay out enormous amounts to shareholders. It's not even like they're saving it in their piggy bank for R&D or whatever. It's out there in the world. I don't know what shareholders do with their money, like buy more yachts or something.
Knowing that colonial legacies are rooted in capitalist power structures that continue to dictate our global economy, let's now begin unpacking the role of Big Pharma in the vaccine apartheid.
We are seeing vaccine scarcity that is artificially created by pharmaceutical companies and policies that are putting profits before public health.
What allows corporations to create an artificial scarcity of vaccines is patent protections. To understand this, we need to first unpack the World Trade Organization's role in this situation.
The World Trade Organization is this body that is kind of the global referee, maybe, around like big trade issues.
The WTO oversees trade between nations. An aspect of trade that falls under the WTO's purview is patent protections under a legal agreement called Trade-Related Aspects of Intellectual Property Rights, known as TRIPS, which essentially looks at and enforces patent protections. Now, this is where things get a little tricky. Pharmaceutical companies have patents on the vaccines that they manufacture. Basically, think of intellectual property as a way to protect corporate power and wealth, which then further allows them to control vaccine access and production. COVID vaccines could be in production everywhere, but instead, Big Pharma patents are preventing access. Now remember, the vaccine research is funded by us, the taxpayers. However, the companies retain patents, which are incredibly lucrative, especially when your patent is for a vaccine that is necessary for the well-being of the world. In fact, Pfizer is on track to make an 80% profit margin. Talk about no risk, high reward. So, how can we talk about equity when navigating a capitalist system that is rooted in hoarding wealth, prioritizing profits from patents over people?
In this pandemic, more concretely clear than ever is that no one is safe and healthy until we all are. And that's really got to be our motivating force or vision. These are deliberate policy choices that were made. Prior to the 90s, like medicines weren't necessarily regulated in this way. There was actually, like, I went down an entire rabbit hole when I was writing a blog post a couple months ago, reading about how, like, I think it was India actually had an entire pre-existing method of controlling and regulating medication that had nothing to do with IP or intellectual property. And then, in the 90s, working with some lobbyists, Pfizer really started pushing for rules to apply the idea of intellectual property, things that, previously we thought about like artists owning the things that they had invented. So moving that concept over to medicine and the things that they were developing. And so, you see like in the 90s, then is actually when the trade related protections for intellectual property got put into the World Trade Organization. And that was really a change in the way that we started thinking about medicine. That all comes down to policy decisions have been made. Those things can change. The world existed before them. The world can exist without them. There are people like living now who could imagine that.
In most countries, the vaccine is available for free to everyone, regardless of where you get it. But in India, that's not the case. You can get vaccinated for free at a government hospital, but government hospitals are overflowing and vaccine supplies are low. If you go to a private hospital, it costs money to get vaccinated, and where there is demand, there is greed. Vaccine capitalism is the name of the game. The Serum Institute of India is the world's largest vaccine manufacturing company, privately held by Cyrus Poonawalla, whose net worth is $13 billion, with his son Adar Poonawalla as the CEO. When the pandemic began spreading globally, SII decided they would lead the charge with vaccine manufacturing, knowing very well that the financial reward would be immense.
Clearly, like, billionaires are just okay with people dying as long as they've got profits. And they wake up every day and continue to make those decisions. And way too many of our policymakers are okay with those decisions.
This is where the story gets interesting, especially for those who believe public good should be prioritized over private profits, and that healthcare is in fact a human right. As SII began the vaccine production process, Bill and Melinda Gates Foundation poured in funding alongside firms like Goldman Sachs and Citi, and together they became chief advisors. SII claimed their vaccine would be for India first, and then the rest of the world. But in fact, 80% of SII's vaccine production was sent abroad at incredibly high profits until the Indian government finally forced a ban on exports in light of recent catastrophic death tolls. But all that to say, reportedly, Poonawalla's wealth rose by 85% in 5 months. One of the vaccine partnerships secured by SII was with AstraZeneca. So let's take a moment to talk a bit about AstraZeneca vaccine. This vaccine came out of research at Oxford University and was initially slated to be an open source vaccine for the good of all. This was all well and good until my neighbor, Bill Gates, decided to give some advice on how you can turn a global crisis into personal profit.
In our world, we have apparently granted billionaires the capacity to make public health decisions. And so you see that Bill Gates of the Gates Foundation has really disproportionate say in some things. So, like you said, the AstraZeneca vaccine was being developed with public funding, as all of these big vaccines that you're seeing have received substantial public funding. So this vaccine was on its, making its way through development and was going to be, a publicly available vaccine that could be distributed then to other countries. Other countries could manufacture it. That information would be out there to do it. And Gates Foundation had this great idea. Don't do that. Hang on to the intellectual property. And then, there's a lot of machinations in exactly how this works that I'm not the best person to explain. But the end result then is instead those pharmaceutical doses can then be shuffled through a variety of paths to make it to become basically charitable contributions, if the pharmaceutical companies decide that they want to make that.
Bill Gates is a philanthrocapitalist who owes much of his wealth to intellectual property law, which is why it comes to no surprise that he is very much against easing up on patent protections to secure the greater good.
And so I think you hear a lot in the news about COVAX is the program that's going to get people vaccinated around the world. The problem is COVAX was created and nobody's put vaccines into it. Nobody is actually supporting this kind of charitable program that they came up with that was supposed to then take the place of a more freely available people's vaccine.
COVAX is a partnership between the World Health Organization, the WHO, and 2 international groups, the Gavi Vaccine Alliance and the Coalition for Epidemic Preparedness Innovations, CEPI. The goal of COVAX was to manage an equitable distribution of vaccines globally. It aimed to deliver vaccines to poor countries at the same time as rich countries were receiving their first doses. But high-income countries secured bilateral deals with vaccine manufacturers and progressed with vaccine rollouts, and COVAX struggled to obtain enough doses to begin shipping. Bringing it back to patent protections, as people continue to die globally with cases starting to rise throughout South America as well, where do we go from here?
So we've been part of a coalition of other nonprofits here in the US and also some globally who are advocating for a intellectual property waiver to get passed at the World Trade Organization. And that was first introduced actually last fall at the World Trade Organization by India and South Africa's representatives. And that's calling for just a waiver of those intellectual property protections around COVID vaccines and some other medical essentials, recognizing that ultimately access to medicine is a human right and people shouldn't be dying while corporations are racking up profits. And I think it's important to mention that this isn't like an idea that came out of the blue, that this was actually done before with access to AIDS drugs. And that's part of why you see South Africa, I think, in the lead right there, is that South Africa is probably the country that has been hardest hit by AIDS. So there are a lot of activists there who saw this coming and were like, wow, we know how this plays out. We've also seen a solution and brought that to the World Trade Organization. So now you see 100 plus countries around the world supporting that position. And guess who is blocking it? Like, if you look at the map that shows who's blocking it, it's the colonizer countries, because they've got the pharmaceutical companies headquartered in their countries, and the pharmaceutical lobbying industry is incredibly powerful. They, like, one of the things they do with all of those profits, aside from shareholder payouts, is buy really powerful lobbyists. So those are, people who are maybe formerly elected officials. And I think we've heard, like, kind of abstractly about that revolving door between elected official and lobbyist. And this is a place where you see that really playing out with tragic global consequences.
The TRIPS waiver was presented to the WTO back in October 2020. However, the U.S. finally came out in support this week on Wednesday, May 5th, 2021. It took mass carnage before the government decided to take a stand in favor of equity and justice. While it hardens me to know that progress is happening, I would be lying if I didn't mention how disheartened I am to know that corporate profits continue to take priority over human lives. These deaths were entirely preventable. The global community was just late to respond. The U.S. finally coming out in support of the TRIPS waiver is just the beginning. There is still a lack of clarity, and we still need to see how negotiations play out. Catherine Tai, the U.S. Trade Representative who announced the Biden administration's stance on the waiver, stated, "These negotiations will take time, given the census-based nature of the institution and the complexity of the issues involved." While the WTO, countries, and companies continue to negotiate, those who suffer are people, namely Black and Brown communities of the global South, all while the countries that colonized us continue to claim their position as the ultimate heroes of the story, feeding into centuries of colonial narratives that continue to dictate how we operate as a global community.
Here in the US, like, we live within this center of power, and the decisions that our elected leaders make really do have global repercussions. This whole example is such a microcosm of the way that the last 500 years have played out, right? Like, you see the US take a policy position that is leading to enormous suffering. Like, they could have just been like, yes, TRIPS waiver now in October when it was first introduced, and like saved untold needless death and so much suffering around the world. Or they could have, dragged their feet. Biden could have changed his position, changed the Trump administration's position when he took office. But again, they dragged their feet. And now you see that we're in this situation globally where the pandemic is taking off. And now, and I want to add too, there's been amazing organizing to get us to this place, even where people are where the US government is supplying aid. But you're exactly right. It's like these terrible policy decisions. And then like, here's our grimy, like maybe not best quality Band-Aid to fix the situation. And that is our global system in a nutshell in so many ways. And I think that it's also really important to note in this, like India is, I think it's the world's largest vaccine producer. So it's not like they don't have the facilities, they don't have the technology to make this happen. It's, once again, corporate power aligned with government power, prioritizing profits over people's health. And that's all playing out in this world of racialized capitalism, where it's not just corporations over people's health, it's some people's health over other people's health as well. And that's playing out in Black and Brown communities around the globe and here in the US, and presumably in other countries as well.
As we have seen play out for centuries, the world's richest countries continue to not hold themselves accountable for their role in the crisis. These inequities are baked into our global economic system. Poor countries continue to rebuild from years of extraction, which continues today. So many of the brands I work with produce in India and South America. As brands and organizations who have benefited from the culture and labor of these communities, it is time for you to show up. Take a stand. Support the individuals you partner with. For everyone listening who wants to learn about how they can support India in particular, consider donating to Khalsa Aid or Hemkud Foundation. Racism is baked into how we operate as a society. Take a moment to do your part in addressing systemic oppression. The fight goes beyond just the TRIPS waiver. It requires us to really look at how the systems we are operating in have been built, breaking them down, and rebuilding with equity and justice at the core. I want to thank you for listening. This episode was heavy. It was unfiltered and incredibly raw. I recognize some of the topics we discussed are deeply traumatizing, and I want to encourage those who may be affected to please create space for communal healing and family. We all lost someone. To everyone listening, I appreciate you for joining me as we went on this journey together. As we wrap up, I want to invite you to stay connected. To learn more about Art of Citizenry and for information on future webinars and workshops, please visit artofcitizenry.com. You can also find me on Instagram at Manpreet Kaura. Please remember to subscribe to the Art of Citizenry podcast on your favorite listening app and give it 5 stars on iTunes. From here on Duwamish land, sending healthy and positive vibes your way.